Hi, I'm your nurse today.
Hi, I have a few questions about rheumatoid arthritis and osteoarthritis. So, what would you recommend for, what medications would you recommend for both of them?
Okay, well, to begin with, they are musculoskeletal disorders, and they are part of the skeletal muscle relaxants. And there's a medication that I would recommend to you, and it's called Skeletal or Medaxalone, and it's basically, it can be used for both rheumatoid and osteoarthritis.
Okay, and so what does this medication primarily do, or what does it serve?
Well, it's mainly to relieve some of the acute pain and discomfort that comes with arthritis.
Okay, so are there any side effects?
Well, like most drugs that you take, you will most likely get a headache and dizziness. Sometimes you can get a rash or even nausea. But the main ones that you'll probably experience is a headache and dizziness upon taking it, like for the initial dose.
Okay. Are there any certain situations where where you would take this medication or shouldn't?
Well, it's what you call contraindications. It basically means that you wouldn't take a certain medication for a certain reason, like if you were allergic to it, or which is called a hypersensitivity to that drug, or if you were pregnant, beginning to become pregnant, or you were nursing, like you were lactating and nursing your baby.
Okay, could you give an example? If I were to have an allergy at the time during I take it?
Well, if that's what contraindication means. Like if you have an allergy to that drug, you won't take that. We would prescribe something else.
So what kind of assessments do you make for arthritis patients?
Well, first I would get your vital signs, and I would most likely weigh you just to get a baseline to compare to later on in therapy, because usually people that have arthritis, they're going to need to move their fingers because you need to have some sort of movement to, because you don't want to stay in the same place because it worsens the pain. I would look at the skin I would look at the extremity that is affected by arthritis, and I would look at the skin over the joint, and then I would probably get you to move as best you can.
Okay. So before taking this drug, is there some kind of plan that we would need to follow to ensure things, ensure my safety?
Yes, it is part of the planning step. As a nurse, we want to make sure that there are no other drugs that you are taking that could react with the new one, or the one that we were talking about, the arthritis medicine. Basically planning the way that the drug is supposed to help you.
Okay. So once the drug is set in stone, what am I going to take it? What's next after I take it?
Well, I would go ahead and administer it to you, and make sure that you have no allergies, keeping in mind that you have no allergies to this drug. I would start a treatment plan for you, a treatment for therapy, taking into consideration that you are in pain and that rest is going to be needed in between each therapy.
So eventually the medication will help me?
Yes, that's what you call a therapeutic response. Basically making sure that your GI upset is fixed, that your fluid intake and your fluid imbalance is improved, and that there's no pain, and that you're able to perform your daily activities even with arthritis, that your pain is lessened.
Okay.
And that's about it.
Thank you.
Okay. You have a good day.